Are you mostly working from home these days?
Yeah. In fact, even before this all started, I kind of moved my life from Boston to Tokyo last fall and was working primarily from home and was all set up and kind of unfortunate but good timing.
Hmm. Sure. Are you from Boston as well, or are you just there for school and work?
I was there for school, worked there for a few years, and I'm originally from North Carolina, though. So it's
Okay.
very interesting to be in Asia and watch this literally roll from China over Japan, then to my home country, and to see it kind of from in between two hotspots.
Yeah. Yeah. So I'm from Florida originally, born and raised, and then actually he's also from US.
Louisiana, from New Orleans. None of us have a Southern accent. What happened there? Why don't you talk funny?
My parents were carpetbaggers, so it's my excuse.
Well, I mean, I don't know, as Bay Kelsey, have you noticed that the longer you stay in Japan, the more your accent, whatever it was before, kind of morphs into something completely different and new?
It internationalizes.
Yeah.
Mm.
Otherwise, it just gets harder and harder for people to understand you. I mean, for the domestic population.
Sure.
That's part of it. Yeah.
I know for a fact that I didn't sound like this, whatever it was, 10, 12 years ago.
Where are you from, John?
Everywhere, but I was born in Uganda, lived in Kenya, but I guess most of my life was spent in the UK.
But which town?
University in London, and my so-called hometown is in Oxford.
Okay. Well, so you have basic, standard UK English.
Boring.
No.
Exactly.
No provincial twang for you.
The occasional, Ugandan slips out now and then.
That would be interesting. I'd like to hear that.
Are we good to go, people?
Yeah, I think so. It's 6:05, so maybe we can go ahead and get the ball rolling. Okay, great. So I'm going to go ahead and kick us off. So hello, everyone, and welcome to the Maker Community's response to COVID-19 online meetup hosted by Fab Cafe and Glug Tokyo. Yes, you can clap. No one can hear you, but you can clap. So I'm Kelsey. I'm from Fab Cafe. John, would you like to say hello? Oh. Unmute.
That would help. Thanks, Kelsey. Hi, everyone. Thanks for joining. My name is John. I'm a writer from the UK via Uganda. I've been in Tokyo for 10 years, Japan altogether a bit longer than that, maybe 13 or so years. I also produce events via Glug Tokyo. Glug is a event production company which began in London in 2007. Earlier this year, in 2017, January, Glug London contacted us, me and some friends, and asked us to launch the Glug Tokyo chapter, which we did a couple months ago. Glug has about 40 chapters around the world, and Tokyo being one of the latest. We organize events connecting creators and innovators in the city. Kelsey, would you like to say something about Fab Cafe?
Yeah, thanks. I'm going to do a quick screen share with everybody. Great. So, we're good? Right, okay. So, basically, Fab Cafe originally began in Tokyo in 2012. It's a good 10-minute walk from Shibuya Station in the heart of Tokyo. Tokyo's not the only place with Fab Cafe. There's actually 3 in Japan, also in Kyoto and Hida. We're also located in Hong Kong, Taipei, Bangkok, Barcelona, Toulouse, Strasbourg, and we most recently opened in Kuala Lumpur in Malaysia. And actually here today we have Kalaya, co-founder from Fab Cafe Bangkok, and also David, who is the CEO of Fab Cafe in Barcelona, joining us today. So what is Fab Cafe? So I'm going to be going a little bit quickly, so please excuse, I just want to get through it. Basically, inside the cafe, we have digital fabrication, so laser cutters, 3D printers, and then we also have the cafe aspect to make it open. So we have delicious specialty coffee with local roasters. We do collaboration with local food makers to make delicious sandwiches and such. We have 3D scanners, UV printers. We even have in Tokyo a laser cutter that's specifically for food. So maybe we do personal fabrication or customized macaroons here. Oh, there we go, thank you. But in general, our mission is to help others find the answer to the question that we ask everyone, which is, what do you fab? So in Fab Cafe, we specialize in creative communities and workshops. So we might be doing a workshop that is led by a local creator. For instance, this is Kaya-san, and she does an acrylic jewelry workshop. We might be doing a shoemaking workshop using unique materials. For instance, Loper holds shoemaking workshops here in Fab Cafe Tokyo about once a month. We also do classes like laser cutter classes, 3D printer classes, where you can work a little bit more closely with the Fab staff themselves to learn how to use these machines. We also have a variety of different meetups. So for instance, the Fab meetup is held around the world in different Fab cafes based on the themes and topics that are interesting for the local Fab cafe. We also work in AI, so autonomous drones that are yachts, for instance. This is a work group that's here in Fab Cafe Tokyo. We also do work in, communities in soft robotics. In Taipei, they do machine learning with traditional instruments and music. Also worldwide, we host a workshop called Global Goals Jam, where we use design thinking as a methodology to look at sustainability and social impact issues. In Bangkok, they have a community of air hack where they're doing prototyping to address air pollution issues. Around the world, they also do material meetups, in particular in Tokyo and Kyoto, where they try to connect creators with material manufacturers to find new or unique or special aspects to new or old materials. We also do community work with Olfactory Design Lab. And basically the idea is to have a space where you can have cafe with community, fab with technology, and add creativity to have community-driven innovation. Yes, and with that, we often seek out new and interesting ideas. For instance, with UFab and the Global Creative Awards. Most recently on award.com, we had a mask design challenge where we were looking for ideas to find the mask of the future. And just recently, we relaunched the Innovative Game Design Challenge to see the different ways that people are gamifying how we learn. So John, would you like, actually, I don't know if you can join whenever I'm talking, but maybe I'll just go over briefly of the timeline for today.
Sure, please do.
Thank you. So first, we're going to be hearing from Asby Brown. Asby, if you want to give a wave. Asby's going to be talking to us about SafeCast and their COVID-19 testing map. Next, we're going to be hearing from Ira Winder about procedural pandemic. Ira's giving a wave, thank you. From about 6:30, we're going to be hearing from Kalaya. She'll be speaking about community-driven innovation, collaboration as an essential element in connecting backlines at the front lines to attack COVID-19 in Bangkok. Hi, Kalaya. And finally, we're going to be hearing from David Vicente, who's coming in from Fab Cafe Barcelona. He's going to be talking about fabrication organizing leaders, emergency logistic management hub, and giving us some words of advice and solidarity from a pandemic center. Following these 4 presentations, we're going to have an hour-long crosstalk, including questions from the audience. And so maybe you're wondering, how can I ask questions to these panelists? Please use the chat to put your questions, and please feel free to chat to each other. We have some people here on standby to bring your questions to John and my attention during the crosstalk. Yes. So, okay.
Okay. Shall we move on to Asby's introduction?
Yeah, that would be great.
Fantastic. Again, this is John. I'm going to be co-hosting today's event with Kelsey. Next up is Asby Brown. Asby is an expert in Japanese design, craftsmanship, and environmental sensibility. He's a lead researcher at Safecast, which is a global sensor network for collecting and sharing radiation measurements to empower people with data about their environments. One of Safecast's founding beliefs is that people should have access to reliable and accurate information in order to make decisions about their own safety and to share that with their friends. Safecast recently developed a COVID-19 testing map, a crowdsourced platform where people can share locations where COVID-19 testing can be done. And Asby is going to be talking about that starting now. Asby, I think you have about 5 to 7 minutes, so the floor is yours.
Thank you very much. Thank you, Kelsey. Thank you, John. Welcome to everybody who's attending. Yeah, it's really a pleasure for me to be here and to be, participating in this with Fab Cafe. As John mentioned in my introduction, I'm a lead researcher for Safecast, and Safecast is actually, our office is just a few floors above Fab Cafe in Shibuya. Fab Cafe for these past 6 years, I suppose, has been 7 years, a great partner for us. We make devices. This is one of our GPS and data logging equipped Geiger counters called a B-Geigi. This has acrylic parts and other things, which we actually fabricate at Fab Cafe in Tokyo. And it's a wonderful partnership. We get along very well. It's a great teamwork, and we all sort of seem to see things in a very similar way. I'm going to share my screen and present a little bit about our recent projects related to COVID-19. So here it is. And then I will start it. One moment. So Safecast began in 2011, in March 2011, actually really the day following the disaster, the huge earthquake and tsunami and the Fukushima nuclear meltdown. And it was in response to the lack of information, a lack of, trustworthy information, a bit of a vacuum. People wanted to know what was going on, what were the risks we had. And ultimately, we decided that it was necessary for us to provide our own measurement system and our own measurement data. And we developed a series of Geiger counters that have data logging and GPS, where someone can walk or drive around with it, and it'll make a map of radiation. And this grew into a global project a lot more quickly than we expected. Initially, our data was coming from Japan with a focus on Fukushima, but within about a year or so, we had data from all over the world. And now we have more than 100 countries represented on our crowdsourced map. All of our work is open source. We try to make an example of best practices for openness and transparency. And one thing is, we make a lot of devices and hardware and software, but our focus is on people, it's on the community. And this is something that's very important. We realized that it's a lot harder to get people together and motivated and keep them moving and wanting to stay involved in things. So this is a special skill set in and of itself. And this is something that we always bear in mind. What we learned, with the response to the Fukushima disaster, it's really a crisis response program, and it's independent. And I mentioned again, it's open source. We're not government, we don't work with government, et cetera. But we realized that people want answers. And we found that we were in a better position to provide answers of the kind that people wanted. One reason was there was a lack of clarity for the information people are getting from government and media. It's hard to make sense of things. This was true after Fukushima, and it's also true now. And it hinges on trust. People need trust. And if a government or somebody loses trust, they may never get it back. We say trust is not a renewable resource. And we believe that trust depends on transparency. If you're not transparent, no one will ever trust you. So we had 9 years of experience working with radiation after Fukushima. We also started an air quality monitoring project, and we have devices and networks for that being set up in different parts of the world. And the COVID crisis started to emerge, and little by little we said, oh my God, we're seeing the same things happening. It was a sense of deja vu in terms of how government is responding, how society is responding, what are the problems with the information, is it trustworthy? Is it not trustworthy? And quickly we started to write about it and to collect information. And this sort of emerged from our own internal chats. We use a lot of Slack for this stuff. And we produced, an article that was, comparing the response to Fukushima with what was happening with COVID-19. And this was apparently eye-opening for a lot of people. And we're saying these are very different disasters, but at the same time, the problems are similar. They're similar structural and societal and communication-oriented problems. So after that, we thought about what we could do to engage our community, get people involved, to help people feel somehow included, because being included is essential in times of crisis. And we thought, well, we're not medical experts, we're not going to do something medicine-oriented, but there were so many questions about the availability of testing, not only in Japan, but in other countries. We heard so many stories of people who felt they had symptoms, they were trying to get tested, but they couldn't get tested. So we used the Ushahidi platform, and in about a week, we put together this COVID-19 testing map. And it's a simple questionnaire with basically 4 categories of questions. Is testing available in your area? Did you try to get testing and were you refused? Did you try to get testing and were you successful? And also one question would be whether you were symptomatic or asymptomatic. And this turned into a kind of a narrative of frustration on the part of people who were unable to get tested. So when people, they finish their questionnaire, the system allows them to leave a comment. And, someone said, I had pneumonia, and the doctor said, they're not going to test you. And we hear this time and again in Japan and other countries as well. Hear other people, someone said, yes, we got testing, waited all day, and, I didn't get tested today, but I'm going to go back and try again. And then someone else, this is someone in Germany also having an experience, said, he didn't qualify for testing. And here's someone who did get tested. And who don't get tested or unable to get testing, they often leave a long story. And these are very emotional stories sometimes, whereas the people who get tested, it's usually very, very compact. So this is one of our projects, and to be honest, we were hoping that it would be more engaging and we'd get more people contributing to it than we actually have seen. So we're revising it, we're putting out more translations for different countries, etc. And we're also working on a new map project that will focus more on symptoms. Meanwhile, we tackled the information problem head on. And again, we looked at the situation in Japan because a lot of us, our core team, a lot of ours are in Japan. And again, the testing problem, what is the situation? What is the policy? How many people are getting tested? We're seeing these conflicting numbers. How can you make sense of this stuff? So we put out a series of articles on our blog that address that and continue to do that. And, this issue continues to be confusing and somehow unresolved. And we also have other projects that we've participated in. I don't have slides for, but one is the Federation of American Scientists made an online chat bot, an answer bot for COVID-19 questions. And we participated in that with a lot of other people to help refine the questions and to make sure that they were understandable to lay people, et cetera. And then there is a project from GovLab at NYU, which is an instructional material for collective action for people who want to start their own groups. So this is kind of a new thing for Safecast to be in a position to sort of help mentor and teach other groups. We've taught a lot of individuals, but it's sort of a new level. And we're talking about this in terms of teams of teams that we're actually making and connecting up with and have a lot of things going on. So here's the link for our COVID-19 testing map. We encourage all of you to check it out. And if you think you yourself may want to contribute some data to that, please do. And if there's someone else you think wants to be heard, we hope that you can encourage them to do that as well. And maybe I'm running out of time, but this is going to be a long haul. We're really just through the first phase or the second phase of something that will be lasting a year or more. A lot of things change. It's such a rapidly changing information environment. It's hard to keep up. It's also exhausting. But we find that when people are able to participate in something that they feel is making a difference, it really helps them deal personally with the crisis and with the trauma that they're going through. So we urge everyone to get involved in something. And I think today we'll hear from a lot of other people who have some wonderful projects in other parts of the world that are really helping both directly attack the problems and also get people involved. So thank you very much.
Thank you, Asbi. That was fantastic. You raised several points. I think one of the most important ones, I think, was creating a platform so that people can feel that they are directly engaged and involved. There are a number of questions that have come up from your presentation. We will swing back round to them. once we've gone through our first round of speakers. Next up, I'd like to introduce another awesome guest today, Ira. So Ira is based here in Tokyo, but he's from the US. He's a researcher and educator and a practitioner who specializes in end-to-end design, development, and implementation of interactive simulations for solving complex problems, both for industry and academia, and also for public agencies. Ira is an expert in computer science, mathematical modeling, city planning, and architectural design. He is currently a researcher based both at the MIT Engineering Systems Laboratory and the University of Tokyo's Graduate School of Frontier Sciences. Ira is going to talk about his procedural pandemic simulation program. Ira, the floor is yours, if you're there.
All right, thank you so much. I should also introduce myself as being humbled by coming after Safecast. I really love their work, and I was actually in Tokyo during the Fukushima disaster, and I can say firsthand that almost worse than the disaster is just not knowing what's going on, and seeing the parallels now is uncanny. So I'm going to just quickly jump into a screen share and show you a project I've been working on. The principal objective I had in building a simulation is to learn. So I'm admitting up front, I am not an epidemiologist, and I am just a person who likes to make models to learn about the world and how it works. So the thing that was happening early on, this simulation is already a few weeks old, is we saw this spreading and we were talking about social distancing as a means to contain the spread. So I was curious about how this virus is a part of a system of humanity in spaces, especially in environments, and how something like social distancing will have an impact and the scale of that impact over time. And it turns out, I've been peeking at the news, this is becoming extremely relevant because I thought I'd make this and it'd be irrelevant pretty quickly, but even in the news, I'm seeing stories about the state of Georgia in my home country saying, hey, let's open up again. And I'm like, whoa, wait, I have a simulation that shows how that could be really bad, even if things look okay now. So let me introduce a little bit about what's going on here. So this is, again, very simple made up city. It's a toy game. In this city, I have created a bunch of people, and those people have demographics. So 3 basic demographics. You have children, adults, and seniors, and they all have different behaviors depending on those demographics. I also have different basic space types. I have dwelling units where people live, office spaces, retail spaces, and public spaces and the like. I can kind of show right now everybody's at home in this initial start of this simulation. At some point I can send everyone to school. So that's kind of what you see in the current state. I can also send people shopping and going about those tertiary activities. So it's kind of basic functionality of the type of behaviors that are possible. So what I'm interested in though is, all that aside, is if somebody gets sick, how can they potentially spread the virus in this population over time? So I'm going to start running my simulation. And now what you see is, 7 days a week, this kind of cycle of 9 to 5, people going to work or school or staying home or going shopping. I'm going to now randomly infect 5 people in the population with COVID in the city. So this is 650 people with 5 people infected. They are going about their day and infecting people. And these are using assumptions that are fairly reasonable, what we know about the virus from the cruise ship that was in Yokohama just a few weeks ago. Incubation time of a little less than a week and a period of infectiousness of about 14 days. And we're kind of seeing just this playing out. We've already gone 3 days in the simulation. There's already 40 people infected, but only in the single digits are actually measurably infectious. Like you wouldn't even know most of these people are infectious because they haven't expressed symptoms yet. So the neat thing I realized when I was building the simulation very quickly is like, okay, I can show how this spreads very quickly. What is an intervention that we might want to really quickly try as well? So I'm imagining at this point in the simulation, or the mayor of this town, and I started seeing reports of my hospitals crowding. I'm actually going to speed this up a bit. you see in the lower right is a graph of the hospitalizations and their capacity. Here, you're starting to see the hospitals overcrowded. So I'm going to implement a quarantine. So in the bottom of the simulation, you're seeing a quarantine go into effect. I'm going to resume the simulation. So you're saying from now on, you're seeing a lot less people going out. Some people still go out because you got to buy groceries and stuff, but a lot less. And we can see over time that indeed people not going out has kind of halted that exponential growth curve. In fact, it's getting to the point now where it's leveled off over time. And eventually you'll start to see a decline in both infections and new people getting infected. So I'm going to pause here because this is the point where I thought it would be obvious as a modeler, like, hey, just because things are getting better doesn't mean it's time to stop the quarantine. But you have states like Georgia now saying, oh, well, things are getting a little bit better. So it's the quote stabilized, let's start opening things up, which there's maybe some reasons behind it. Oh, well, we can open businesses, but everybody still stays far apart or something like that. But let's say that I am that state and I say, well, let's open things up. You know, now that things have stabilized, what does that mean? And people have also talked about the Spanish flu of 1918 and how there was actually two humps. There was the initial infection, people got serious, but then they started relaxing and the second wave was even worse. So it's using this simulation, I can actually recreate that second wave. And you're starting to see that now. As soon as you lift the quarantine, you're seeing a new spike in infections. In fact, it might actually be worse the second time around still, even if the first time around was pretty bad. So that is kind of what I learned through this model, you know, again, armchair epidemiology. But I thought it was useful for me. Maybe some of you will find it useful for explaining how quarantine or why it's effective in certain instances. I've also made this an open source project. So in the upper left corner of the screen is a link to my GitHub repository if you want to download it and run it yourself. I tried to make it so that with little or no coding experience, you can actually download it and open it as long as you follow the directions. So, all right, thanks for your time.
That's great. Thank you, Ira. If anybody has any burning questions, by the way, feel free to throw them in any of the current speakers. Otherwise, I think we'll move swiftly on, Kelsey, to our next speaker, if that's okay.
Yeah, sounds great. Thank you so much, Ira. Great. So next up is going to be Kalaya joining us from Fab Cafe Bangkok. Kalaya has been the co-founder of Fab Cafe Bangkok since 2014 and has been a lecturer at university doing architecture and planning since 2004. Kalaya excels in gathering multidisciplinary teams composed of various stakeholders to find new solutions from the Fab Cafe network. She graduated from MIT with her master's in science and architectural studies and design and computation. And today her talk is going to focus on the theme of community-driven innovation, collaboration as an essential element in connecting the backlines with the front lines to attack COVID-19 in Bangkok. Thank you so much for joining us today, Kalaya. I'm gonna pass the mic to you.
Thank you for having me today. Sawadee ka. My name is Kalaya from Fab Cafe Bangkok, and today I would like to share our experience in what we do in Thailand. So I will just skip to the presentation now. Okay. So as I said that today I would like to share our experience working with many fabulous teams and sharing projects developed in Thailand during the past 4 months. So this is like the current state of COVID-19 around the world, taking from the Microsoft Power BI. And then in February, after the situation in China is getting better, people in the group of people in Wuhan hosting the hackathon called Hack for Wuhan, asking mission-driven developers, innovators to come up with a solution to help fight the current outbreak crisis, which later on inspired local projects in many countries. So the situation in Thailand, I would say that is might be better. Like it's not that very very serious right now. So right now we have like 2.8 thousand confirmed with 50 days as of April 23rd. An outbreak of COVID-19 has been ongoing in Thailand like since January 13. since like many Chinese love to travel to Thailand. And when the country made the first confirmation outside China, we have the first person contact infect COVID on January 13. After that, a government surveillance among incoming travelers revealed a small number of cases throughout January. The first reported local transmission was confirmed on January 31st, but the number of cases remained low throughout February with 40 confirmed by the end of month. So this is like how I try to map out the event in Thailand. We have, as you can see that before like February 18, the number is very low. We have like very like only 1 or 4 people confirmed cases, but then like after the in March, we have like a sharp increase in mid-March, which was attributed to several transmission clusters at the Lumpini Boxing Stadium on March 6. Confirmed cases rose to over like 100 per day, which made government declare a state of emergency effective on March 26, following a 10 p.m. to 4 a.m. curfew announcement on April 3rd. So I try to map down all the projects that we and people in Thailand, like makers in Thailand, try to make during the past 4 months, which we can divide it into 4 phases. The first one is the pre-travel restriction. The second is travel restriction period. And then the third one will be the after Lumpini Boxing Stadium event. And then after that, the curfew. For the first one, the pre-travel restrictions is around like January till mid-February before there is a news about the super spreader in South Korea. At that time in Thailand, we only focus on temperature and symptom screening. We have self-monitoring and practicing hygiene and avoid crowd. At that time, many startup makers who initially worked with healthcare sector start incubating their project with medical team, like such as H-Lab. She's the owner, the co-founder is the startup using data to redesign hospital operation and service. So that group start working on negative pressure project and redesign service operation to be ready for the COVID-19. Another team is run by Ayala, is a makerspace, Mr. Prasad Sakdet Udom. He starts sharing his thermal imaging camera to be used for public building, screening, like public building, office building. And then after that, there are many advanced projects like AI CT scan, as you might heard from China that they have it. So in Thailand, we don't have many cases, so we use the pneumonia data for that. And then we have like a PCR kit by Wistech, starting working on that. And then remote quarantine system to reduce exposure risk of infection for health workers is run by Jula Engineering School. And then for Fab Cafe, we got requested by ER medical workers that they have a mass shortage. And then we work with TCDC and our partner, Tejai Fusion, to develop a respiratory mask and start preparing for the tools device, such as HME or breathing system filters. The second phase is the travel restrictions. At this time, the number of confirmed cases is increasing, but because there are some people returning from illegal workers from South Korea, in this phase, there are 4 application release, like Sabai bot from Open Dream is a personal health record logbook, a COVID bot, chatbot for COVID-19, pre-screening by Freak Lab, COVID trackers by 5 Lab, a local online virus track map. And then the fourth one is by Future Forward Party, is like crowdsourcing app for face mask and hand gel retailers. For the project, at this time, there are many, like 7 confirmed cases. So many people are very active about their DIY mask. So Singer Brothers, like a sewing machine company, hosting many workshops in the mall and also in TCDC as well. In this period, notable project is the ventilator. They started at this time, and then many of the healthcare workers start to calling for operation tools, such as face masks, all acrylic chamber, negative pressure test booths, swap shield, and like diving mask wall. Yeah, and interesting in this case, we have one date in March 1st. So some temple asked us to like starting research on the date management with Thai temple about like how to do the pre-made and how to handle the bodies. And then the third one is in starting from mid-Feb after the super spreader in South Korea. Oh no, sorry. After the Lumpini boxings, at this time, people are very cautious about the situation because the celebrities, Matthew Dean and his wife is very famous one, infected with COVID-19, and then make people really cautious about COVID-19. So the increasing number infected cases lies to like 1,000 and more than 100 per day confirmed with 12 days. So the project at this time is like thinking about field hospital, a delivery robot with telepresence systems, some tools for daily operations, and disinfection like UVC sterilizers in transportation matters like isolation chambers. And the last one is the coming up with the PPE and PR. So this is like, and like at the end of the March, many government officials, they put out their funding to support all the projects related to COVID-19. The last phase will be about the curfew period. At that time, since the working is very limited, so this time they are mainly focused on like deliver the donations alive safely to the hand of medical teams. So the platform like InfoAid, Bangkok Help, Bang Pan, I mean sharing in Thailand is released at this time so that people can receive the donations. Okay. So this is like how we align the stakeholders for the project. Like the first one, the project InfoAid that we did with the Design for Disasters, Pejai, which is the crowdfunding platform, Open Dream, which is the app developer, and Change Fusion is the non-profit social enterprise. So this project is start from the experience of how we design for disaster. 2011, we have a Thailand floods, and then she mentioned that the main problem of this situation is that the donation cannot arrive to the people in time. So many turn into waste. So she wants to create a platform for that. So we have this, receive the request from hospital, and then distribute the request into like factory, material makers, universities, and then raising fund from through trade. The second case will be with their startup. So some startup in Thailand can scale up during COVID-19. Like this one, we work with the Brain Dynamic, which is the startup focused on like brain interface. They develop a smart pulse, which is like the vital signs monitoring systems. During the COVID, they received funding from NIA to produce this, make this, and then deliver to the hospital. Material is another important factor during COVID-19. HEPE, H14 is very difficult to find because normally in Thailand, we only like imported from other countries. So in our situation that we needed, we have TCDC, we should have our material resource centers connect us to the companies called low filter ball. Yeah. So with them, we can develop the HME filters, and then we have the GC manufacture the plastic part and deliver to the hospital. So I think their time is running out. This is like, we have like many projects working with the hospital, but all I would like to say is that the most important thing is we have to put the hospital as the leaders, and then we have to listen to their needs, use it, validate, and approve every project. And then together, I believe that do what you can and with what you have where you are. Yes, thank you very much. ขอบคุณค่ะ
Wonderful. Thank you so much, Kalaya. Very inspiring. So actually, I have one small question that is maybe very specific to you. You mentioned that Thai Temple is now talking to you about how to deal with death management. So they see that you, maybe they have some positive experience with you as a logistics manager or project owner, and now they're asking for you to help them deal with bodies. I'm wondering like how you feel about that, or like if you feel like ready to take on any project, even that kind of project. What was your response in that case?
To me, I think is the thing that we should prepare for worst case scenario, right? So at that time, not many people discussed about that yet. Yeah, so we need to do some research on that regard. Yeah, but since the death toll in Thailand is very low, so like the temple is still be able to handle that. The only thing that they are focusing on now is that to transfer the bodies to their cremations.
I see.
Yes.
It's really fascinating. Great. So if I can ask you, Claire, to please unshare your screen, and we're gonna move on to the next guest speaker. Thank you very much.
Thank you very much, ka.
Great. So moving right along, thank you very much, everyone up until now. So the next speaker I'd like to introduce is David, coming in from Fab Cafe Barcelona. So yes, David is the CEO of Fab Cafe Barcelona. He graduated from the University of Barcelona with his degree in physics, which has provided an extensive knowledge of mathematics, electronics, and the practical application of mechanics. Projects at Fab Cafe Barcelona are viewed analytically, adapting and altering when necessary due to complex and unexpected situations. These skills are combined to provide training to universities and businesses, and also guide David in his management of resources and ongoing projects at Fab Cafe Barcelona. Without any further ado, there we go. Yeah, I would like to pass the mic on to David. Thank you very much.
Thank you, Kelsey. I'm going to go ahead and share my screen. There. So yeah, I'm David Tena. I'm the CEO of Fab Cafe Barcelona. I've been in the digital fabrication sector since 2013, and I've taught at a few universities here in Barcelona. And today I'm going to explain a little bit. Well, this is Barcelona right now, empty streets since the 13th of March. And today what I'm going to talk about is a little bit of my perspective from the maker community on how things have developed here. Before I will be speaking since the quarantine, just to keep a little on context, to give a little context. Just before the quarantine started, we've had a massive event here in Spain, which a lot of people were on the streets, and it was just the weekend before the confinement started. So that was on the 13th of March is when the confinement started, and that first Monday on the next week after confinement, there was a massive rush to supermarkets. People desperately looking for toilet paper and going back home and just trying to get a hold of everything they could. And yeah, during those first days, as a makerspace, we were trying to find a way to chip in. We tried to see what could be useful, taking into account that not everything could, for example, get into a hospital. It has to have a few standards to be able to be used. So we tried to find something we could do in that sense, keeping that in mind. So on the 19th of March, on that same week, we joined a massive Telegram group with thousands of participants called Coronavirus Makers, in which when you joined, you filled the form saying what machines you had, and then you were given some STL files to produce whatever you were told that it was needed. After a few days on that group, we were a little worried because we had the laser cutter stopped, and that's when when we decided that that we would try to look for a broader approach, not just focusing on the 3D print, but everything that we could do. So a couple of days later, we joined. Well, we created a WhatsApp group with some technological directors from a few hospitals in Barcelona. And then we started to get specific requests and information directly from them. So after that kind of got into place, I joined a fellow coworker on the 23rd, and we created a nonprofit group that we tried to get help where was needed. While not only thinking on a single approach, not just fabrication, but we kept in mind both logistics. We had a branch of research and development, and we also had a fabrication branch that we tried to keep a broader view of what was needed both in hospitals or third age people residences, etc. So during the second week of confinement, we were already a 900 plus volunteer group in which we were taking into account like different things that were needed by hospitals. From the fabrication branch, this is a few of the things we do. For example, these are 4 different kinds of visors, for example, that we do, starting from the left. That's one made out of rubber, which is not destined to normal hospitals because from rubber you cannot disinfect very well the coronavirus. That, for example, it was for a petitions made from penitentiary hospitals, for example. So because they also had to keep in mind a security aspect. So that's, for example, a version destined for them. The second one is the one we make for laser cutter, with a laser cutter, that the speed of the production is for every one of them like a minute for each one. So we can do like many on every day. Then we have the 3D printed one, the one, for example, they're using through the coronavirus maker group, that they have this model or even an updated one because this photo is old. And then the one from the top right is a pediatric version that we were asked to do because sometimes they had to take children to hospitals because they had maybe a respiratory issue and they didn't want to risk them getting infected with the coronavirus. Then on the top bottom left, we have one of the masks we are doing. We are doing of 2 different kinds. One, the School of Doctors sent us both wool and then the chirurgical textile, so we make both of them. And on the top bottom right, we see the ear protector that we're doing with laser cutter, for example. This is an example of a direct petition from a few hospitals back from the first week. They were validating the possibility of connecting 2 patients to one single respirator. Because they ran out of them, so it was I think they were starting. We did like 50 of them. Also, we made a few prototypes of an aerosol box, which is basically done during the process of intubation, so that the coronavirus is not spread through the room. And also, we have used the working space as a logistics center. For example, we distribute water bottles to hospitals so that patients do not use the glasses, so it's easier to avoid infection, for example. We are also developing a respirator. It was also a direct petition from a hospital because there were a lot of maker groups already making a mechanical-based respirator, which basically is with a mechanical movement, you compress and decompress a back mask. And this is also the kind of respirator that was developed by SEAT, which is a car company here in Spain, and they produce a big series of them. And the one that we were asked to develop is an engine respirator. So instead of doing a mechanical movement, we are working with with an engine, so that the flow of the of air that receives the patient is controlled through an engine, and also it has the sensors that it has to have to detect the lung capacity of the patients, also the reflex that they may have because they still breathe on their own, so it adapts to that, etc. So that's the kind of respirator that we are developing. And also we are doing a perfuser, because the perfuser is a syringe pump which automatically injects medicine into the patient during a long periods of time, and it's some machine that's also lacking in some hospitals. So that's another of the medical instruments that we are developing. So up until now, what we have been able to provide is 22,000 masks, more or less 50% of the chirurgical ones and 50% of the wool ones. At first, we were self-financing. Then we did a crowdfunding to raise money. But at the end, we were receiving the material when we ran out of the money from the crowdfundings. We were receiving the materials directly from the School of Doctors. So they were both sending us 50% of the chirurgical text and 50% of the wool to produce these masks. We also produced over 1,000 medical gowns, more than 500 visors. That's not an updated number, but it's more or less 600 right now, more or less. We also gave 400 tablets with 400 SIM cards so that patients could speak with their relatives. We've distributed more than 10,000 liters of water, and yeah, we've done a few prototypes already, a few replacements made in 3D to be able to help hospitals with replacements with that. Basically, this is all we've done from the fabrication part. Maybe what something we felt, for example, that it's been hindering us is that when we order material, it takes a long time to get to Fab Cafe, for example, or wherever it has to go, because we are managing more fabrication spaces, and we are getting help from other companies like Alpha from Telefonica or Trotec, that they do the laser cutters. And also we've also managed to be like the contact between particulars and companies, and I think that's a very important task that has to be done to have people not just one place but several places, like also seeing like the big picture to not waste opportunities when they come up. For example, the tablet and SIM cards opportunity that came up with the donations from the respective companies. So I think that one of the things that we think is most important during this confinement, when you get into confinement level in your areas, is to keep in mind that logistics will be affected. So if you have your own system in place, it will be much helpful. If that information that you get is reliable, is also like super important to get the facts right, because with more than I ran out of time. So information is also super crucial to get right. And I think that having a macro vision of everything is also super important to keep in mind while operating during these times. Thank you so much.
Great, thank you so much. Excellent. Yeah, I feel like I'm seeing a common thread between all of the guest speakers talking about this kind of access to true or correct information, or access to, how should I say, people or other organizations or material producers that you can trust. And this kind of, how should I say, like foundational infrastructure seems to be incredibly important. Yeah. So yeah, thank you so much.
Yeah. I'd like a comment, or I'd like to ask David
Please.
and Kalia something, if that's okay. So one thing that really strikes me, of course, is the adaptability that you referred to, David. And I'm happy we spent some time last year. I could visit Fab Cafe Barcelona, and it's a very social space. It's about people. You had these elementary school children coming in and out, and you had the co-working space, and it's a very active type of community, but in a way also kind of contained and kind of narrow. And what I see is happening with you in Barcelona and with Kalaya in Bangkok is this great expansion of reach and contact into something, kind of adaptation that puts you into contact with hospitals, with logisticians, and with others. And one thing that struck me is that both of you mentioned, being approached by hospitals. If I'm correct, the hospitals reached out to you, and in Japan, I don't think we've seen that yet. It may happen, but there may be some cultural differences. But it's interesting that the hospitals reach out to you. And I would like to hear a little bit from both of you about that process. How did you get to know the hospital people? And, how did they start to trust you, for instance, enough to give you these important projects to help with?
Well, in Barcelona's case, the thing was that prior to the coronavirus confinement, both Cecilia and I had already done either projects or workshops with hospitals. Cecilia had even a workshop thing programmed, and myself, I have taught at the Biomedicine University of Barcelona. So we already had that contact. But I think that if we wouldn't have had that contact, the hospitals would have found a way to get in contact with the people who they saw in the newspapers that were 3D printing stuff. So it came from them to find that immediate help, because it's something that in the first days no one knew exactly what to do, because we did not have the information directly from them. We just heard stuff, but we did not have that information. And I think that in our case, it was because of that network that we already had in place.
So it was a kind of, it grows into what we call a network of trust, though. And in a situation where government can't or is not willing to, take responsibility and provide these things, sometimes we're forced to improvise, not just technically, but socially as well. And to rely on these contacts, trusted contacts. And it may be a relative, it may be a classmate, it may be someone else. But it's interesting that in your case, it developed into a very, very large scale program. And Kalaya, was it similar for you? I mean, did you know the hospital people beforehand, or did they reach out to you later?
Actually, we work with the hospital closely for almost 3 years now, because one of our research segment is about healthcare development. Yeah, so many of the hardware startup in Thailand work with us already. And then for the hospital to test all their hardware gadgets, we need them. Yeah, so basically we kind of work with them before this COVID-19. Yes.
And one last question, and I'll shut up. But do either of you have encounter a lot of regulation problems where hospitals say, no, we can't use it? I think one of you mentioned that the ventilator, the respirator couldn't be used except by critical patients. But were there problems? Because we hear this from other makers around the world that even though they make this stuff and the hospitals want to use it, there are regulations and other things that prevent them from being used.
Well, from Spain, is being brought forward very different kinds of respirator projects, and then I think that more than 40 different projects. And well, they've put a fast track to be able to do the homologation faster. But what we've seen from a meeting they had for consulting those 40 different respirators that they put forward, is that even though they put that fast track, for example, in that fast track, it was not contemplated the magnetic interference that the respirator could have with other equipment, for example. But they still want to be able to say that does not happen. So even though there's a fast track in place, still much has to go through the same process that it has to have gone before the confinement.
Just quickly, if I may, Great question, Asby, and thanks for your reply there, David. There's actually a question that came through on the Q&A for those who are joining via Zoom, asking about whether you had any legal issues. I think the homologation question, I think, is always one that will be faced by startups and makerspaces when they're jumping into a highly regulated area such as the medical field. Sorry, Kelsey, back to you.
Thanks. Yeah, it's a tough situation, which is why I'm so always incredibly impressed by the fact that these kind of makers, these kind of community, how should I say, maker community members can go straight to the source, be contacted by the people who need the equipment, the professionals themselves, and be able to connect them with other professionals, other working professionals, such as designers and engineers, programmers, and the users, the doctors themselves, to make these prototypes, which end up becoming deployed. Great. So anyways, thank you so much, everyone, for your presentations. We're going to be moving now into the Crosstalk session. So today we have 4 guests that we've invited to help facilitate a healthy and fun discussion about what we've been talking about with our guest speakers. So maybe just real quick, if each of the 4 Crosstalk members can just very briefly introduce your name, who you are, where you're signing in from, so that the people listening at home can know who you are and what perspective you're speaking from. In my lineup here, the first person that I have is Tim. So Tim, if you'd like to say hello.
Hi everyone. Sorry, I might have to mute that sound first. So I'm in not Jakku, but Taipei. Yes, so I'm in Fab Cafe Taipei. So my background is also in architecture and urban design. But we use Fab Cafe as a platform in Taiwan and connecting obviously to the network in Tokyo, Bangkok, and Barcelona, and elsewhere as well. So should I ask a question now or later?
Let's wait just a sec. I'm gonna go ahead and have the other 3 join. But yeah, keep the question in mind for after everybody said hello.
Got it.
Next up, I see Cecilia. If you'd like to say hello.
Hi, everyone. I'm Cecilia Tum. I'm also from Barcelona. I work with David and also part of the co-working that is attached to Fab Cafe, which is Makers of Barcelona. So.
Great. Welcome. Thank you for joining us. Next up is Shane. Shane, would you like, oh, sorry, you're in the middle of breaking. Great. Hello. Thank you for joining us.
Hey, I'm Shane. I'm currently calling in from Tokyo, and I built COVID-19Japan.com back in early February. So that's the angle I am coming in from.
Great. Thanks so much. And finally, we have Christina.
Hi everyone, Christina here, joining from Sapporo in Japan. It's a city in the north famous for maybe beer and snowboarding, I guess. Yeah, I'm joining in from 2 perspectives, I guess. One is I've been involved in building a contact tracing app in Japan, and we have a very interesting situation relating an app in Japan involving the governments, different organizations, startups, NPOs, companies looking into the space. And I'm sure you've heard a lot about contact tracing, but I hope I can offer some new insights if possible. And another angle would be, I'm the board member of My Data Global. It's an organization that works with the use of personal data. And we have had how should governments and public health organizations be dealing with public data? Should it be balanced? Should it be used? Should it not be? So if anyone have questions about that, I would be happy to discuss. Obviously, there's no right answer right now. OECD has been crazy discussing all this. EU Commission has been leading the charge. So yeah, those kind of topics are on my agenda as well.
Excellent. Such a serious topic for such an awesome background. No, I love it. It's fantastic. Great. So
it's Roppongi.
Roppongi is so dead right now. I'm glad you're bringing it a little bit of life, even if it's online. Great. So yeah. So yeah, I'd like to open up the floor for questions, comments. First, maybe hear a little bit from the people on the panel right now, and of course, we're going to be also bringing in questions from the audience from YouTube Live as well as on the Zoom channel. Tim, you had something that you wanted to ask?
Yes. So I just want to talk a little bit about the, what Ira is doing with the simulation that he's doing right now. I think first of all, really is a really fascinating initiative that you're taking on in terms of not just reacting to what happened, but actually started to see what are the kind of possible outcomes. And as you mentioned that, that especially anticipating for what are the potential second wave. So one thing that I was just thinking about and wanted to ask you is, because it's something that I'm also thinking about. I think Aspie knows about it because we share a little bit about that on the Safecraft Slack. But one thing is for the anticipation is actually also about talking about the virus mutation. And then also the other thing is there's also another open source program called the nextstrand.org that which is tracking the global movement of the virus mutation. So I'm just thinking about in terms of I'm glad that both of these are the open source projects. So in some sense, as we think about the possible simulations or projection, is that there's also the chance of putting in the genetic mutations data, and then putting that into the simulations. Do you what do you think of that possibilities?
All right, good question. Thanks for that. So the issue of mutation would affect at least two parameters of the simulation. So it currently doesn't incorporate mutation. It incorporates statistics about the virus as we knew it maybe 2 or 3 weeks ago from available data sets. So mutation is interesting because one, as it mutates, coefficients like the attack rate and the R value of the disease might change. So if we have up-to-date information about different strains and those R values, that could of course be very relevant to the outcome of the simulation in different environments. The second thing, which is starting to occur to some people, and it's not clear, but if the disease mutates enough, or maybe even a little, it's not clear to what extent immunity kicks in. So even if you have the disease once, we're still not 100% sure you can't get it again. And that's right now my model assumed. I naively thought a few weeks ago, well, if you get it, of course you get immune, right? But that's an assumption, it turns out, was maybe one I shouldn't be making. And it's unclear whether a mutation event might make it even less likely that you can become immune to it. So those are the two clear ways I can imagine that affecting the model. But yeah, if you're willing to dive into the code and add that parameter to the model, it's certainly feasible.
Yeah, got it. Yeah, thanks.
Great, thank you guys. Thank you for that. I have a question for, where are we? Asby.
Yeah.
Are you there? Great.
Mm-hmm.
Asby, what's been the response to the latest Safecast platform, the reporting of COVID-19? I think it's testing, right? Is what you're doing.
Yes, well, the map that I was describing a few minutes ago was for people to report their experience seeking testing.
Yeah.
So it's not really, asking if they were positive or negative or whatever. It is really trying to shed light on how available testing is and to call attention to sort of the social impacts of this. So, information, there's many different needs for information. There's a certain medical need or scientific need. And in the case of, say, Fukushima radiation, you have to measure the radiation, but there's, in order to make certain judgments that are scientific, but there's also a social need. People need to know, they want to know, they're concerned, it's causing them, various stresses, what we call psychosocial effects, which can be very serious and long lasting. So we are trying to address more the social need for this information. And, we, like I mentioned, we had hoped that we would get more input into it early on. And some people, actually colleagues overseas who have been following and advising us on our project for a long time said, gee, why don't more people from Japan seem to want to put their information about testing on? And this led to a long discussion about stigmatization. And we've seen that many times in Japan, in many cases. There's ongoing issues of bullying in school, for instance. And after Fukushima, we saw that residents from Fukushima were stigmatized if they had evacuated and gone to another city. People don't understand, if radiation is contagious or not, but it doesn't really matter. They simply find an opportunity to stigmatize and ostracize people. So we noticed, and others have noticed, and there was a woman named Rochelle Kopp, who's a writer and works on cross-cultural, intercultural communication, and she wrote an article for Japan Times that I was interviewed for as well. She had noticed the same thing, that people in Japan often did not want other people to know if they had been tested. It's not even whether or not they were infected with the coronavirus. Just the fact that they were tested would somehow lead to suspicion and ostracization, and people would wonder if it's okay to hang out with them anymore. And this extends to institutions as well. Where it's said that nobody wants to be the first person to bring an infectious disease to their company or their school or whatever institution they belong to. That person is regarded as a criminal, generally, socially speaking, and everyone else who gets it after that is regarded as their victim. So this means people do not often want to share that information, even if it's anonymized. And we are very careful to make it clear that it's anonymous. So this is a very interesting issue, and we see this in other places as well. This fact that people do not want other people to know if they have it. And again, anecdotal data, we hear stories almost every day from people who say, yes, I was someone I know was infected and the doctor said, don't tell anybody except your immediate family. Now, this is very odd and counterproductive. It should be counterproductive in a healthy society. So I think it points to something a bit unhealthy in the society. And in terms of other issues, and I don't want to go on too long about this, this is a very noisy information environment. There's lots of projects and information competing for people's attention, lots of maps. And again, Shane's map is fantastic. We rely on that and we, point people to that all the time. There's a lot of information out there. There's a great information overload, and it may not be clear to people what the benefit is of contributing to this. Once it builds up to a certain density of information like our radiation map did within a few months after Fukushima disaster, then it's clearer that there's something big going on here. So we haven't reached that critical mass yet.
That's great. Thank you, Asbi. I think what's come out very clearly in your reply just there was that there are obvious cultural issues that have to be addressed when you're looking at citizen science platforms like yours that are global. Different communities in different parts of the world will respond differently to a bottom-up type crowdsourced platform like yours. On that point, Shane, you've developed a COVID-19 tracker. Can you just say something a bit about that and what kind of response you've had so far from the community that you're working with?
Yeah, so it started out as 2 or 3 of us volunteering together and putting a basic map together because we couldn't find a lot of very clear patient data back in February. And the focus very early on was, making sure everything's open source and that we're building it together. And that attracted a lot of other contributors, both on the data side and on the code side. And we've seen the data, like our biggest focus, because it's the most difficult part, is the processing of the information coming out of the government. So that has been tricky, but it is slowly improving, and we're seeing a lot of the Stop COVID projects from the government kind of being replicated across each prefecture, which is good to see.
And just talking about tracking platforms, Christina, you're doing something really interesting regarding contact tracing. Can you just shed some light on that?
Yeah, so I think most of you know contact tracing from a Singapore perspective, but something we're trying to do is more focusing on privacy preservation. I think as B mentioned, some maybe problematic aspects of Japanese society, and that can be true also regarding the privacy. So I think the recent survey showed that about 75% on average in global in 30 countries are willing to sort of sacrifice part of their data or rights in response to COVID, whereas in Japan, the numbers were only 35%. It's just twice lower. So what we're trying to do is when you install an app, you get an identifier that is anonymous. It is a person identifying information. It's still PII, but it's very, very hard to link to an individual. We can link it to a device, but not to an individual. And that's honestly the only information we are collecting. And I think you also heard about Apple and Google doing something similar, as people ask me. Well, it's not exactly similar. It's the biggest problem was the Bluetooth connectivity between the Android and iOS. And basically, even Singapore was struggling with that in European countries as well. And the giants came in and said, well, we'll help you guys. There'll be connectivity. And there's a first step. And in the future, we also try to make it available if you opt in on our phones. But still, when you are trying to use this, in the real life, you have to talk to the medical institutions, you have to talk to the government, and that's where giants cannot adapt those applications in each country, right? So there's still Googles and Apples could not replace the efforts in each country. Those several aspects that to point out there. And another thing, actually the question I wanted to throw out here is, there's so many different initiatives happening, right? Like even within this contact tracing apps, there's several groups popping up in Japan. And initially there were only two of us, like super privacy preserving, super data collecting. And now we have like different players popping up in the middle because they see, they see a pie there. So, and the government is also struggling in Japan because they've never really been involved with this ICT related and they don't really know how to respond, I guess. So how do you choose? Do you approve all? Do you choose one? And it's good that we have innovation and creativity, but what's the balance there also? So yeah, my 5 cents.
Christina, just quickly, who are the partners involved in your project?
Right. So it started as an OSS, literally just a couple of engineers coming together. And now we're talking to several medical related companies who are willing to publish the app, because to publish an app on an app store, you need an entity. And the government is willing to approve our app, but they don't want to be like in the front. So they don't want to be it as a government app. It would be a app approved by the government, published by this medical institution we are talking to. There's several.
That's great. And somebody wanted to jump in just there. Who was that?
Yeah, it was Shane here. Yeah, I think the collaboration is a really important point. It's been very fun to watch all the different projects popping up everywhere as the outbreak spread. And I think we are moving in the right direction. For example, on our side, we started with massive Google Sheets where we were tracking every patient, every detail about them that we could find. And now that, for example, Tokyo particularly has their internal Stop COVID project that's open source and everything, they have good direct sources for information. So we're now saying we could rely on some of these other data capture methods to not do so much double work. There's so many trackers, as you mentioned, that it's unfortunate to see so much double work happening, even though so much of it's open source, right? Like if we can get together, and we've our project, we've reached out to a few different ones, and there's varying levels of interest in working together. I feel like people often like to say like, okay, well, I want to kind of do my own thing, right? But now that the prefecture level is working harder to do these projects, we can push each prefecture's work to them, right? Like that individual group. So I think we're moving in the right direction as far as double work on the data side, but we still have a lot to go, a lot of progress to make.
That's a good point that you make there, Shane. When it comes to a crisis like we have right now, and you have these various entities popping up from the bottom up, some of them are more established, like Safecast. Some are coming up in response to the current situation. How important, and this is a question for anybody out there who wants to try it, how important is trying to get coordination among the different maker communities, tech communities, creative communities, and also at the next layer up, corporate, and then at the very top layer, government. How important and how difficult has that been, trying to get coordination between these three layers, the startups, if you like, the corporates, and then the government layer on top. And anybody can try that if they want.
From my perspective here on Spain, for example, maybe I had a naive vision at first, thinking that maybe we would get that at least the information or the not just coordination, not the coordination, but at least like knowing a little bit on what was needed and everything from the government, which it did not happen, of course, but at least not in the level that we were operating in sense of trying to get what was needed the same day that we were asked to give whatever we were asked to do. But I think that right now, after that month of different groups popping up and assisting, one of the worst things that can happen, which is not too bad, is that maybe the same place receives from two different channels, so their resources are not optimized in that sense. Because sometimes there's so many groups that have formed that we do not have tracking of them all. So, and sometimes if not only a hospital, but if third age residency asks for 50 visors for their 50 employees, for example, and they ask us, but they are also asking a few places else. So they will probably get double what they need, for example. And maybe that could have been destined somewhere else, but I think that's a low price to pay for the alternative, which is not waiting for a confirmation on if anyone is doing them or whatever. So that's from my perspective of what has been happening here.
May I make a comment?
Please do.
Yes, I think the type of coordination that's needed really depends on the type of project, and what David's describing, of course, is physical logistical coordination, where duplication of effort can really be costly in certain ways, whereas information gathering and information distribution is a fairly weightless thing, and there is a lot of duplication of effort, I think, but it's fairly easy to coordinate through information, and we found that very early on. People reaching out to us and reaching out to other people, working in these very distributed teams, which is something that Safecast really developed very early on back in 2011, how to work with people all around the globe who are never meeting in person. And this has made this a very much easier thing to do. That said, when we try to think about how to interact with institutions like government, there's a huge question. And our attitude at Safecast is to be independent. And this may not be necessary for everybody or the best way for everybody, but for us, it's independent. And for instance, talking with Shane, we had a very good conversation with him, I think 2 weeks ago. Time flies. You have a very good team. You're teamed up with Japan, Japan Times, and you have a certain respectability through that. And I wouldn't be surprised if government people are already reaching out to you to help them understand how to put out data, et cetera. So you talked about the Tokyo city government website, which has actually improved quite a lot. It's interesting, it's open, and yet we can't really trust the data, right? There's still a lot of uncertainties about the data. So it's a very interesting question about how much to coordinate and how much contact to have. Shane, how do you feel about independence of your project as opposed to, really as a conduit for official information?
I mean, I feel like it being independent and not necessarily tied to anything helps some people trust the information more, right? Like just because it doesn't have that stamp on it, some people may take it more seriously. I don't know if that's necessarily the right way, but we're pretty clear that we pull the information from those government sources directly. But yeah, like you said, the Tokyo project is official, right? It's got the stamp on it. So that seems to be still the right way to go. Like, I don't think we want to be postering that we are not the government, right? Like, I think we should still push as much effort as we can into letting the government be the source of truth and giving them the tools that they need. But yeah, that's my thought.
And yet you're also an important independent check on, the validity of the data. I mean, you have this team, we talked about this, combing news reports, et cetera, and kind of vetting the data. And I think that's a very important service. For Christina, I'm also very interested in that. And, yes, ultimately you may need some buy-in from government, et cetera. But we noticed that the Ministry of Health in Japan partnered with Line to do this very interesting online survey, which is ongoing. It's not clear at all how that's actually being used to influence policy. However, it's an important gesture. Are you dealing with the Ministry of Health by any chance?
That's for Christina.
Yeah, we're dealing with several ministries, so it's very Japanese. It's actually not on the Minister of Health that's leading the efforts. It's actually also the Minister of Economics that has a lot of say. And because Japan didn't have a GovTech team like Singapore does, or they don't have like a tech ministry. So they had an efforts that forced the government to create that tech team. So Japan, in my perspective, so the Line example you mentioned, so that was a very quick response. It was very impressive, but still, they did not have this sort of mindset to use technology in addressing these problems. So it was after they saw this community effort, they saw that they need to sort of coordinate that this tech team started. So to answer your questions, it's Cabinet and Minister of Health, Minister of Economics, and a couple of other ministries as well sometimes, because you need that. And another thing is, I think in terms of coordination, we are dependent on digitalization of the government, and that's currently a huge blocker. Because if you want, for example, to collaborate with public health institutions or the governments, if they're still sometimes collecting information using fax, you need to first digitize that. You need to first to make that data digitally accessible and talk about visualizing it or using it. So that's also some obstacles I've been observing.
That's great. Thank you, Christina. I think your video is breaking up a little bit, but I think we pretty much understood what you said. Quickly going to Cecilia, you had a point to make, Cecilia. Please go ahead.
Hi, I just wanted to say, since I'm here with in Barcelona with David, and he was very much focused on maximizing the use of the 3D tools that we had at Fab Cafe, and I also wanted to help, but I didn't know how. But what I did notice was that there was an increase of outbreaks in nursing homes, and while a lot of the PPEs were going into hospitals, and obviously for doctors and caretakers, the nursing homes were a little bit forgotten, and we were having a hard time actually finding materials even for face shields. Acetates were in high demand at that time. So I was asked by some of my friends and my colleagues here, and we came up with this idea of, well, can we use very, very simple, easily accessible materials and make a face shield so that the elderlies could stop touching their face. And we use a plastic divider, folder divider, and put any simple ribbon, and we made a device that they could even an elderly could use. And from then on, we realized that there's a whole entire vulnerable population of people that would need to have these gears, but not necessarily have the machineries or the tools to create them or to make them. And then that got extended to talking to some of my colleagues in Africa and saying, well, what are some of our lessons learned that could be carried through in developing countries? And what we realized that we need to find materials that could be locally sourced. We need to create very simple instruction sheets that they can distribute. And so from there, we create a whole series of just how-tos, how to make hand sanitizers, how do you make soap, how do you make face shields, a whole list of things that they could just distribute on a very local kind of a analog level to help provide for PPEs in various different countries. So I just want to make a point that even in very low tech, local, limited supplies areas, we could still contribute in transferring some of the lessons learned.
That's great. Thanks for that, Cecilia. Back to Tokyo with Ira. Ira, you've got a point to make about data?
Yeah, sure. So I enjoyed the discussion between Asby and Shane about data and the questions you brought up about whether the independent data sources versus the official data sources are the ones you go to. I can say anecdotally, as a user of the data, I very much enjoyed having both. The reason for that is you use the official numbers for one purpose, but again, like you say, they might be inaccurate or incomplete. And you use the independent numbers to either confirm or deny the validity of other numbers. So in very real terms, I needed to know for one simulation, what was the rate at which people were being tested and what was the threshold for the test. And it turns out the official sources were not very great at telling you what the threshold was. You needed to hear a certain sample of anecdotes about people being turned away from doctors before you started to understand what the threshold was. And it turned out to be you needed a fever for like 4 days and a certain temperature and all this stuff. So that was, I loved the website you built for that because that's how I confirmed my assumptions. So, and in going into assumptions, I want to address a quick question from Cecilia. She asked about whether density was used in a simulation. I can confirm, yes, the density of space where people gather socially did in fact have an impact on that simulation and how quickly things spread. So anyway, to wrap up, a quick contribution now. I have a question to the group that if you have thoughts, you can think on it and maybe answer. It's how is this crisis going to permanently change the maker community going forward in terms of relationships or how you work?
That's a great, I think, question that we can use to lead us towards the wrap up. Shall we begin with David and Cecilia in Barcelona and then work our way back towards the east?
I think you should go first, David.
I was going to say the same.
Sorry if I can butt in just for a second. I really appreciate Ira's question. And maybe whenever we do this wrap up, I'm also very curious to know, I think a lot of us are managing multiple projects at the same time, and some of them are succeeding and some of them are failing. And I'm just wondering if you have any particular success stories or if you can mention any project that you yourself are doing or you see being done in the maker community that you think is going to have lasting effect or continue to be used, continue to be deployed, even in this like post-COVID situation. So if you have any particular project that you want to highlight that you think is really great and is going to continue to influence society or something like this, I would really love to hear it. Thanks.
I can share some of my opinions. I think one of the things that I've noticed is that initially there were so much noise. There was a lot of noise happening. Everyone wants to contribute. Makers tend to want to be very proactive, and they are the first one to get involved, and that's great. But on the other hand, I think at least I think in Spain, there was so much going on that, we talked about collaboration. There was not already a collaboration in place to make that more efficient. So I think, and then not only among makers, but also among, other, entity like the hospitals, like the government. And I think that moving forward, I think governments and hospitals and other entities are really appreciating how we quickly responded to this. And maybe hopefully there will be a new protocol in place to get us into the pipeline of producing these things when there are crises that are happening. And this is what I'm hoping for. Whether that will happen or not, it's I guess it's up to us. But yeah, David, what do you think?
Yeah, thinking on how it will change the maker community, I think that what's going to change or is changing is how the relationship between the maker and some of the professional companies that are fabricating with more industrial way of fabricating. And I also think that it may help, the maker community may help for those companies that may be affected economically to make an industrial reconversion of their already working fabric to industry to be able to convert, if they wish, to something that can be more useful now, and also not only sanitary speaking, but also economically speaking, because a lot of industries are being affected, and their normal operation, even if tomorrow ends the confinement, they're going to have problems producing what they were producing and selling what they were selling before. And the fact that the maker community has a great adaptability, and the professionals within the maker community tend to have a broader view of different, and they are up to date in technology, I think that they can help to bring forward for those companies to make this conversion. So I think that could happen for makers.
That's great. Anybody from? Well, let's try Kalaya. What's your reply to that?
So actually, I would say that at first, Fab Cafe Bangkok would like to positioning ourselves as the healthcare maker space. So right now, the situation changed because all the makers now working with hospital. So we kind of like have to design new strategies if we are going to continue with this. Yeah, because as we try to ground our connection with government regarding aging economies and like healthcare, beauty techs. That's why at first we are the lead for that. But then after the situation, there are many universities and many makerspace have this kind of contact. So it will be very late ocean for that. Yeah. As for the things like how can we proceed after COVID-19, another thing that we haven't done yet is trying to add like data like AI, machine learning into hardware, because before we only like work with other teams, yeah, and then we never involved into that kind of development. So we tried. I think that after COVID, we might have to reconsider that we have to have a staff or have a team member working on that.
That's great. Tim in Taipei.
So I think I guess the situation that coming out of this pandemic is actually for the makers community. At least we can speak for the Fab Cafe Global Network. Like, we've never seen so many messages pop up in our inner group before, ever. But after this, because in some sense we're isolated, but at the same time, because we're working online, there's no distance in that sense. That barrier between the physical geographic distance actually kind of disappeared. So that's one thing. The other thing is actually because, especially in the case of Taipei, we work quite a lot with the private sectors. So in that sense, actually, what we heard from even like the ex-colleague that I had before, or some other companies, that actually they kind of speed up the process of reforming, how they come up with a solution. Yeah, and also the other thing actually is kind of very interesting is how we even see our understanding of a solution also changes. Previously, if everybody is going offline, everybody needs to be like 30 people needs to gather in one room and then having one solutions. That no longer available. So in this case, the way of we thinking about solutions actually is floating. There's no one solid solutions, but actually how we actually pass things forwards and how we can deploy locally. That actually speed up that types of mentality change. at least the way that we saw things are happening with either the clients or collaborator that we see in Taiwan. So yeah.
That's great. Thanks, team. Coming further east, let's go to Shane.
I think my view of how it's going to affect the maker community is down to collaboration. So we've had, disaster events in the past, but it's been some time since we've hit one globally like this. And I've seen so many comments, both with our project and elsewhere, of people that weren't really aware of these collaborative projects and how fast you can spin things up, and just the feeling around open source and how anybody can jump in and help. And I feel like that's going to drive a lot more people into the maker community as a whole. Just people weren't aware that you could throw some code up on GitHub, automatically deploys to some server, and then anybody can submit an issue or submit some code change. And because this problem is in front of everybody globally, most of these trackers, which is what people are constantly checking, are open source, right? And that's eye-opening for so many people. So I think this is a great time to see some expansion in this collaborative community as a whole.
That's awesome. So we'll go to Christina, and then we'll end up with Ira answering his own question. Christina, how is the maker community going to change after the COVID situation?
I think in the case of Japan, it would be interesting to see what actually changes and what doesn't, because Japanese culture is super resilient to changes, I would say. Even if, even tsunami, it did change several aspects, but, it still went back. So for example, usually Japanese companies or, collaboration happens during the drinking times in nomiyas, right? And now that you can't do that, you have to stay at home. I'm actually wondering how would that sort of collaboration culture / working culture, do we see more discussion culture popping up? Because right now everything is very formal. It's very hard to talk on what you actually think. Would it stay or would it go? And also for all these solutions that coming up, I think initially the thought was, sure, let's create something that will help the COVID, but also how can it be used in normal life, and you go back to normal. And for example, even the contact tracing can be used for other diseases, like I don't know the English name, it escapes me, but so different diseases as well. So how can we keep using this technology? I think what interests me the most.
Fantastic. I think what may happen, Christina, is that you're going to have online izakayas or bars in Japan. I think that's the way forward. But joking aside, Ira, back to yourself for your own question. How do you think the maker community is going to be changed post-COVID?
Well, I don't know if I want to claim to be a maker. Would be. I would claim that I'm a researcher, maybe. But even in that sense, it would.
Isn't everybody from MIT by default a maker?
I may be, sure. I make things. It happens to be code. The biggest impact it's going to have for me is even more awareness than usual, the challenge between balancing the academic process of submitting your ideas for review, getting them thoroughly vetted in a responsible way before they're kind of integrated into the knowledge of society. The challenge right now is that information is needed very urgently, and the current academic processes can't keep up, right? So I have to balance between putting things I learn out there before they're vetted in the traditional way, but knowing that they're still helpful, but having to put all the appropriate disclaimers like, be really careful with this information. I think it's better than nothing, but please be very, very careful with it. like learning the language for putting things out there in a delicate, responsible way. It's probably ever more important because of this, and will continue to be.
That's great. Kelsey, do you have any thoughts on that, or would you like to begin the slow wrap up?
Oh, we can begin to slowly wrap up, but I think that Christina brings up an interesting concept that I think is very relevant for maker community in general. She talks about resilience, and something that I think is very interesting about makers or researchers, whether you're a maker of data or a physical maker of a prototype, hardware, or what have you, is this kind of sense of urgency to respond to the situation. And I think that that characteristic is very essential in a time like this. And it's something that Tim mentions earlier that like the Fab Cafe Global Network, like the owners or core members, they became increasingly active, like their communications increased rapidly whenever this happened. And I think part of that is the way that they kind of deal with this new pandemic, deal with this new challenge, which is to ask themselves, what can I do? What can I make? What connections do I have? And how can I bring it all together to decrease waste and increase productivity? And yeah, basically, I just want to say that I'm really inspired to hear from everybody today about what their answer has been to that, whether it be to not necessarily challenge, but create a check to government by providing access to data or providing access to stories, or whether it be to give doctors the reins and say, look, like you're the ones that need this this equipment, you're the ones that need this personal protective equipment. So you're going to be the center of this project. As the user, I'm giving you all of the agency in the world to dictate this design process. Yeah, in short, I'm just very, very inspired by everything that I've been hearing tonight. And I just want to express appreciation for everybody using their Friday night to join us for this.
Great, thanks, Elsie. Finally, from my side, I think as a writer and a journalist, one issue that comes to my mind is the question of trust. There seems to be a huge trust deficit right now across the world. Who do you trust? Can you trust official institutions, governments, for example, or ministries and governments? Can you trust corporations and the data and the information they share? And can you trust communities, startup community, maker community, other social communities? So trust seems to be going through a bit of a crisis at the moment. And of course, from the side of media, you have from mainstream established media to social media based platforms to even individuals who have huge followings. The one central concern is always, can you trust what you're seeing? Can you trust what you're reading? And I think we've looked at various ways that the different speakers have dealt with the trust question. One question that was raised was about collaboration, which we haven't touched on right now, but I think communities, maker communities, companies, governments, being able to work more proactively with media outlets to put information that is trustworthy out in front of the public is super important. I know that Asby and I have talked before about, Asby is based in Japan, he's the co-founder of Safecast, one of the biggest citizen science communities. And I think Asby, last time we spoke on a different platform, the question I raised then was, what level of coordination have you, for example, had with the journalistic community in Japan to ensure that your information is being widely disseminated? Can you just quickly touch on that? What success have you had with communicating your message using either mainstream media or your own media or other kinds of media?
That's for me to answer?
Yes,
yeah.
Please.
We found after Fukushima it was really important because the journalists themselves didn't really have scientific background. They couldn't understand the actual, issues, the scientific issues. They didn't know how to explain it very well. Over the years, all media used to have science journalists, but they've all disappeared. So it was very important. And we spent a lot of time giving background backgrounders, like meeting with journalists. They would come to our office, or we'd meet them for coffee and explain something like the water at Fukushima, or what about radiation, or who's who in the government, et cetera. And this was very important, and also a way of establishing trust. And it was a long time before we actually allowed ourselves to be quoted as experts in the media, although we welcomed having media come to cover our project. And those things are very, very different. It's very similar now. It's very similar now. And there's a lot of things happening behind the scenes with conversations and email chains going on with journalists from, major media platforms, and, looping in other people. What do you think? Have you found this information? What do you think of this doctor? What do you think of this politician? It's very important to have an independent voice, someone who has no dog in the fight, and no agenda. And that's a role that we at Safecast found that we could play. And it's something that we value very, very highly. And it's a very difficult thing. Again, this is going to be going on for a long time, and it's also global. And we can talk about Japanese media or US media, to some degree European media, but this is a global media issue. And I think we're all going to be confronting this for a very long time. One other thing I just wanted to add is one big change that we're seeing, though, is this acceptance of the norms of the open source, the maker community, as a very adaptive means of addressing these big problems, these emergency situations. And yet, it shouldn't have been necessary. We all know this is because the people whose job it was to do it initially, to plan for this and prepare for it, didn't prepare. And we are stepping in to fill a pressing gap and try to help literally save lives of people. And we all think it's worth doing. We all will be happy that we've done it, but it shouldn't have been necessary. And yet I think the visibility of the maker community and open source community and the hackers and the citizen scientists is being raised by this global response, everyone all around the world to this by this community. And I think it's a very, very positive thing for bolstering the understanding of how important the work that we're all doing is.
Great, thanks, Asbi. And as any good journalist should do, is to accept when you're wrong. And Asbi just reminded me that he's not actually the co-founder of Safecast, he's the lead researcher there. Quickly before we wrap up, Ira, I love your simulation. I think it's very educational when people can use simulation, gamification to convey complex information. Have you also considered working across the table with, say, designers, UX designers, to make the simulation experience more, how should I put it, user-friendly?
It's a great question. Actually, I would characterize probably the last few years of my research as trying to bridge that gap. So my admission is that my degrees are actually in architecture and planning. And I've only been practicing computer science out of necessity as a career researcher. I think it's essential. I have basically made a clear pattern of whenever I initiate a project, it's usually a relationship between a domain expert and some piece of knowledge, and working with them to make their domain expertise palatable to a broader public, a non-expert public, via good user interface design or good implementation. So anybody who wants to knock on my door and say, hey, I got this really wonky problem that I don't know how to express. Yeah, that's tends to be, I believe that in the future we'll live in a world where people are pairing up in those two types of skill sets all the time, just creating beautiful expressions of complexity. And that's kind of the world I want to see going forward.
Yes, creating beautiful expressions of complexity. I love that. That's a very good note to begin the wind down on. Kelsey, do you care to take us out?
Sure, yeah. Just real quick, if I may. So actually Fab Cafe is not just in Tokyo, but around the world, is moving a lot of their activities online, such as this event today. And so I'd just like to quickly share, because I think maybe some of the people who are listening today might be interested, some of the future activities that we're going to be doing. Let me do screen share. Great. So, John, you mentioned this this element of trust, or, you know, basically like moving forward because you have trustworthy connections or you're building trust with interesting partners or something like this. And I've, in recent times, never seen this to be more true than in this event, actually. So this event is organized at Fab Cafe Tokyo. It's called How to Make It Safe. And basically what I've seen happening is around 60 to 65 people will come. A lot of them are Fab Lab members. A lot of them are doctors or nurses, people who are just generally interested in making or are makers themselves. And, you know, I'm sure everybody hears recently, you know, Zoom has all these security issues, you know, you don't want to be trolled or something like this. In this case, actually, they take a very opposite approach. It's like everybody somehow knows each other. And even if you don't know each other, there seems to be this kind of, I don't want to say tribe, but, you know, even if you don't know anyone in the room, somehow you feel like you're a part of this movement. And so anyways, they don't have any, how do you say, closed video. They allow anyone to talk at any time. Anyways, it's a really great series. They've had 2 so far. Basically, the theme is how to make it safe. So trying to provide a very accessible platform for anyone to hear about what kind of precautions that makers and medical professionals are using to bring fabbed medical devices into the hospital. So anyways, there's going to be another one coming next week. So please check out the Fab Cafe Tokyo website if you're interested. It is all in Japanese. I will say that a lot of the slides are in English for those of you who can't understand Japanese. Another one is going to be hosted by Fab Cafe Hong Kong. So this is an online Fab meetup for immersive distance learning. So basically they're going to be exploring immersive distance learning with 2 guest speakers. And yeah, I highly recommend that as well. Please check out the Fab Cafe Hong Kong website for details. And finally, I mentioned at the very beginning of this presentation, one of the meetups that we do, which is called the Material Meetup. So actually Kyoto is going to be hosting an event online for Material Meetup. So if you're interested in this, please check out the Fab Cafe Kyoto website. And that's it for that. Again, I just want to thank everyone for joining us today. And thank you, John, for co-hosting this event with me. I'm super stoked to say that this is the first of hopefully many, many collaborative events offline and hopefully, or online and hopefully in the future offline as well. I appreciate you all joining us today. And yeah, there's going to be the recorded session of this on the Fab Cafe TV YouTube channel. So if you're interested to look back and see what was said or share, it's going to be there just to let everyone know.
And
John,
just
do you have anything
quickly,
to add? Yeah.
One last thing, for those who are interested in what's happening with GLUG Tokyo, the sponsor, I suppose, of this event, GLUG Tokyo is on Facebook and also on Instagram under GLUG Tokyo. We hold hopefully awesome events like this with fantastic collaboration partners like Fab Cafe. We normally want to do things offline, but you know, such as the situation as we have it, but it has to be online at the moment. But we look forward to doing more events. And thank you for joining.
Great. I will mention as well, somebody asked me or asked everyone in the chat if we could share the links for future events. And just to let you know, the slides that I've been using now, they're open for anyone to view. So I put the link in the Zoom. We'll also pass it over to YouTube if you'd like to review any of the stuff from that. Yeah, great. All right. Thank you so much, everyone. I appreciate you all joining us. One person.
Thank you so much.
Please feel free to unmute yourself if you'd like.
Bye.
Thanks so much. Great. Everyone, please be safe and take care. Be healthy.